Hi, I'm Sridevi from Bellary. After finishing my online classes for 9 months, I finished my simulation training where I learned about OPU, embryo transfer, and hysteroscopy. And later I finished my clinical attachment. Since this is a tertiary care center where we get many of the referral cases where previous history of failed IVF cycles, complicated, complex cases. Anu Kottur ma'am, she made us do OPU. Bhavani ma'am taught us so many things, and Meenakshi ma'am explained each and every protocol. She made it understood and where it can go wrong, what are the changes we have to do when we start the protocol, and regarding the scans, what we do, and how to monitor the cycle, especially regarding the counseling part and the documentation thing. IVF is completely documentation. It is not the documentation. What we learned from here is extremely meticulous. What they document here, the consent forms, what we take here, and how we counsel both the husband and wife regarding the process, and what they go through the treatment. Everything is explained, and they made us stand with them and understand the process of the protocols. And we have got many chances for to do OPs also, complex endoscopic surgery, fertility-enhancing surgeries, and we have seen embryo transfers, and we have seen positive results. We have seen everything what an tertiary care IVF center can handle. And most of the complicated cases, they've handled it very nicely, and we've seen the positive outcomes. Came across one very interesting case where she had 4 IUI cycles failed and 2 IVF cycles failed. And this was a last hope for her, because patient, when she came to OPD, she was very much lost, and she had given up. Actually, she didn't wanted to go for further, and she came for surrogacy. But what happened is later they counseled, the consultants counseled them very well, and they explained the issue, what can be done, what is the treatment they're planning to for her, and they planned pooling cycles for her, and they got good blastocysts, and they transferred the blastocysts, and now she is pregnant, and we are very happy for that. And one more case where she had a complex endometriotic cyst and multiple implantation failures, and this was her second embryo transfer here with us, and it is positive. We've seen the cases and the protocol simultaneously, and the scan, how the patient was responding. So we know what to be done now. So we will become more confident after finishing our clinical attachment to how to handle the cases, how to counsel the patients, and what protocol to be followed. So I'm thankful to Kamini Rao ma'am for designing such a course which is helpful for all of us. Thank you.